Hi everybody, welcome to another video. Of course, we're back with another clinical week topic. You guys know, if you've been following this channel for some time now, I try to make the topics that we talk about here on YouTube topics that are actually clinical to what I'm seeing in practice and things that are walking in the door. And you also may know that it comes in clusters and clumps, usually 3. So when there's one condition that presents, I'm waiting for 2 more people to call, and that is going to be their major ailment of our time together. So I wanted to bring light to this topic. It's very applicable to a lot of things right now, and we'll talk about kind of the cross connection there. But for those that are new, welcome. I'm so happy to have you here. My name is Dr. Elise Tercy, and I practice functional medicine here on Long Island. For those that are veterans, of course, welcome back. If you guys like to stay up to date with all things holistic wellness, health and wellness related, please be sure to give the video a like if you actually enjoy this. And also be sure to subscribe to the channel here. And one other thing too, before we get started, is make sure that you're subscribed to my website, because I have some really exciting stuff coming up January 2022 that may be only applicable if you're kind of connected through the website, so you can stay up with announcements. They're not going to be posted here on YouTube. So little housekeeping stuff there, guys. But I wanted to talk today about a subject that often is a little bit of a confusing thing for people to understand. And often a lot of doctors and patients kind of miss the boat on this condition to some degree. So stay tuned if you're interested to learn about what that one is. Today we're talking about chronic myalgia encephalomyelitis, CME for short, aka chronic fatigue syndrome. And I'm also going to kind of cross-connect this to its cousin, fibromyalgia. We'll talk a little bit about these 2 conditions today. And I actually have notes here, so if I'm looking down, I just wanted to make sure that we cover all things that are applicable to this. What the heck is this? What is this condition, chronic fatigue syndrome? Well, if we break down the name, chronic, we're often fatigued, and it's so debilitating that it actually has a diagnosis of its own. It is a diagnosis of exclusion, which means that if people are searching for answers to this condition, often the way that they come to know that this is what they're dealing with is by ruling out other conditions that look similar. For example, people that may be suspected of having this may go to some of their infectious disease doctors or rheumatologists looking to see if they have Lyme disease or any associated tick-borne illness. They may end up going to see somebody for pain. Their body's in a lot of pain, so perhaps rheumatology. They do the full blood work panels to look at rheumatoid factor, to look at antibody load, to see if there's anything underlying. And sometimes there is. You can have fleas and ticks too, right? Like sometimes there is something going on paired with the same condition of CME. Sometimes they're not. There's nothing that we find, and then we go into what is the diagnosis of inclusion in terms of what is the criteria if we suspect that it's happening for you. A couple of the key factors in terms of symptomatology that may allow or lead people to say, oh, I think I'm dealing with this, is that there is this unrelentless exhaustion. So for example, they're sleeping and it's not rejuvenating or recovered sleep. That is one of the things that often people will share with me when they're coming in, and really we're looking to see if this may be going on for them, is they're like, no matter how much I sleep, I'm still tired. I could sleep anywhere, I could sleep everywhere. Sometimes, and I don't know that clinically this is super applicable to what I've seen, although I do find it could be applicable to people. It's just not as common in my practice, where people have exercise-induced intolerance, where after they work out, they're actually more fatigued post-workout. I actually find, clinically speaking, that some of my patients report that they feel a little bit better, but I also do have people that say they feel horrible. Some people can't even exercise. That's how bad this can be for them in terms of their symptoms. Sometimes they develop lymphadenopathy. So the glands get swollen in their neck, the glands get swollen in areas of their body, maybe fever of unknown origin, where they're spiking fevers that really don't have a rhyme or reason. The fevers are just happening, but they're not happening in any type of consecutive order. They're not happening every Friday. They're not happening once a month. They're kind of random. That's another possible option. And then obviously myalgia, pain. So by default, the word, the kind of diagnosis, it tells us what it is to some degree that the symptoms are that people may be dealing with. Okay, so innately in the name are a couple things that we can learn about the condition. And the way that I want to talk about this is a couple different things. So in the research, PubMed, National Institute of Health, this is still a etiologic idiopathic disease, right? We still don't know why this happens. There's no if this, then this, and boom, you have the thing. It's a little bit of everything. So really what's happening in this condition is you're getting an immune system dysregulation response. You're getting a neurologic response. You're getting some type of energy system response that's not working as well. It's actually a full body condition. It's not just like, oh, when I have XYZ, this is what happens. The reality of disease and dysfunction is that none of them are just that specific thing. You know, I can't even give you an analogy of like, this is only dealing with one thing. For example, thyroid. Oh, yeah, okay, fine, it's manifesting here, but thyroid conditions are also very similar. There's a multitude of things happening with thyroid stress. There's hypothalamic pituitary adrenal dysfunction. So the whole kind of thought process around healing is understanding that when someone has CME, they're dealing with a lot of different layers and not just one primary organ system. And I understand that we are very reductionist. A lot of us have this reductionist mentality of what's the one thing that's wrong with me and why do I have chronic fatigue? And it's not that simple. There's a lot of layers to it. A couple options though that are in the research and in the literature, and I do agree with these because I see it, are viral load. A lot of people that are saying that they got infected with the virus, they end up developing or noticing that after the virus, they weren't the same. Something shifted with their immune system and they realized that after the virus, they weren't the same. Now, the traditional thing that can actually be the driving force behind this type of condition is Epstein-Barr virus or the herpes simplex viruses. There's many different classifications, different versions of them. But mononucleosis or the kissing disease is the virus or is the name of the condition where the virus is Epstein-Barr kind of hiding in the background. And I have personally dealt with Epstein-Barr. I had Epstein-Barr virus when I was in college. And I remember so vividly thinking that ever since I had this virus, I wasn't the same. And I really honor and understand when people say that because I absolutely believe viruses are kind of the crux and the component to a lot of this. So you may know, oh yeah, I had a virus, but you also may never know that you had a virus. A lot of people don't know that they've been exposed. I mean, look at what's happening in our world kind of right now. There's so many ways that our immune system can flag or modulate who will and who will not get symptoms from something, even though they may be exposed or infected, right? You can still have an infection in your body and have no idea that that's happening. However, though, let me just talk about EBV for just a moment here. EBV is one of the known things in the research that is the virus that can create chronic fatigue syndrome. Also, it's the virus that can also sometimes cause fibromyalgia. It has a little bit of a different diagnosis of exclusion or inclusion, meaning what does it not look like? What does it look like? And these are the things that if someone's presenting, they have to meet the criteria, in terms of pain points and certain things that are happening. But they look very similar. Both of fibromyalgia and CME look very, very similar. And the thing that I will say is that when I'm looking in lab work with a lot of my patients for infections that are stealth in nature, like viruses, I often find cytomegalovirus and Epstein-Barr virus as the components. Also varicella zoster, that can also be kind of hiding behind the background and creating immune system dysregulation or immune system modulation issues where the person gets the virus and they're just having a really difficult time navigating kind of how to put out the fire, right, from these viruses. We live amongst viruses. We live amongst pathogens. We're friendly with them. We're not friendly with them in certain degrees, but that is a known thing, that viral load is a known causative agent, whether or not you understand that you've been exposed or had a virus. Some people have no clue. They're like, what are you talking about? I've never had a virus. You just might not realize that the prodrome, you didn't feel it per se. and now you're dealing with the aftermath, right? We can develop post-viral syndrome. It's a real phenomenon. I have another video, I'll link it down below, that I talk a little bit about this in more depth. It's called post-viral syndrome, which crosses into this condition, right? Because that is maybe the component of why you got sick. Another possible option for why people develop this is emotional trauma. Trauma. And I don't really talk too much about this on YouTube. If you guys are following me on Instagram, then you may have a little bit more exposure to my thoughts and feelings around our energy and all the things that are related to our health. But a lot of times there is an emotional reaction or an emotional trauma, a trauma response that can precede having this type of condition as well. We may or may not be conscious of it, right? Sometimes we don't even know with our conscious awareness what happened to us that may have caused an energy issue or some type of shift. Now, the reason that that is true, right? Like if we just hold off on the esoteric stuff for just a moment, is that when you have trauma, you do change your entire biology, right? The nature of trauma is such that our system gets dysregulated and we start to live in a place of sympathetic dominance where we're bathed in the chemical cocktail hormones of stress, and that can create problems with our ability to fight. So one of the things that we think about is that we're always pinged, I kind of describe it that way, we're always bombarded by pathogens and critters and infections and viruses and fungus and mold, and we live with this stuff. However, we should have a strong enough system to be able to get rid of, or at least protect us like a shield from being able to have these things enter and then stay in us and live in us and create dysfunction. They're always in us, right? Viruses are always in us, but it's kind of the way that they're working in the system that creates dysfunction through what they do, gain of function, just how they kind of shed their stuff. So I do want to mention that if there's a trauma, you can definitely go back and say, oh yeah. You might even say, no, I don't recall. There could be lag, right? A lot of us think that, well, if it didn't happen in the moment, then it's not possible for me, right? Like if I didn't have trauma in 2021 and I'm sick in 2021, well then it can't be connected. That's not true, right? We don't always know what's going on behind the scenes. Our bodies are innately intelligent and wise. And this is not voodoo, stuff. This is research based, that there is psychoimmunology studies that show that trauma, all the things that are associated with trauma, death, divorce, grieving processes, physical abuse, emotional abuse, all the things that may fit into the bucket of big T, little t trauma are going to create dysfunction in our energy systems, namely our adrenals, namely our endocrine system, and then also our ability to fight infection. We get weakened. Okay. And then I wanted to also answer some questions here. So some people are asking me, is there a lab test for chronic myalgic encephalitis or encephalomyelitis? No, there's not. There's not a specific test, but what oftentimes does happen, I will say, is that we do find increased cytokines and increased pro-inflammatory markers in people that have this diagnosis happening. They have a lot of inflammation, so they may have a high level of C-reactive protein, which is an acute phase liver protein. It's a protein that comes out of the liver in response to systemic stress. They also might have a elevated SED rate, a erythrocyte sedimentation rate that could be elevated. So there is no specific, I'm going to order a test to see if someone has CME. It doesn't work that way, but it does innately in some of the comprehensive functional style blood tests. We're able to deduce, remember, this is a diagnosis of exclusion. We've excluded that it's not this, it's not this, it's not this. What else could it be? Then we go searching down the rabbit hole and kind of clinically correlate with what your symptoms are and your blood findings. And so with that being said, there is no specific end all be all that, yes, you have this in the blood test. It doesn't show up that way. But there are some changes that we find in terms of dysregulations. I've also seen it very possible that people have positive ANAs that have no other identifiable cause, right? Like they might flag or turn on their anti-nuclear antibody, but have nothing for other antibodies, like for example, anti-Rho, anti-Smith, anti-double-stranded DNA, anti-myocardial antibodies. We've looked at what possible autoimmunity could it be. Sometimes nothing shows up. And so people are left to say, but I have an autoimmune titer, But when you've tested me for further things that we do know we can look for in terms of the autoimmune caliber, lupus, Sjogren's, MS, Hashimoto's, nothing shows up. What could it be? I have seen Epstein-Barr virus turn on autoimmunities. I've seen that turn on positive ANA. So there is no specific lab diagnosis per se, but there are things that can allow us to say, oh, this is what we're dealing with. And the reality of it is that when I have a patient that comes in and they're saying, I'm really freaking tired, no matter how much sleep I get, 8, 9 hours, 10 hours, it's not rejuvenating. They still could sleep anywhere and everywhere. Cognition issues, they're not able to stay focused or clear. Brain fog is really just inflammation that's traveled into the brain. So brain fog or cognitive impairment is telling me that you have inflammation, but it's moved through the blood-brain barrier and now it's here. Okay, so we also, that is one of the criteria as well as brain fog, cognition impairments, energy issues. So the energy issues are coming from mitochondrial issues that happen at the tissue level. So there are some cellular changes when someone's dealing with this condition that we actually can identify in their energy systems that are not optimal for them. And so that's another thing that we're able to find is that they're having this issue with their reactive oxidative capacity. They're having this reactive issue where their immune system is super dysregulated, and we do find that there is more of an increased and decreased depending on the nature of kind of when this is happening for the person. Their T lymphocytes, right, part of their system, our innate and adaptive immune system, are differentiated. They're having some issues there. So that would be something we can look at. Sometimes we can order immunoglobulins, we can order CD4, we can order T helper cells. There's specific immune cells that can tell us where are we across the board with this person's immunity in terms of their B cells and their T cells. These are just parts of the immune system that can help us to understand this a little bit further. I want to comment on this one. Is myalgic encephalomyelitis a real disease? Yes, it is. It used to be thought that if we can't find it, and our conventional medical model kind of still has this thought process, right, that if we can't objectively identify it in your lab work, it must be in your head, right? Like you must be making it up. Maybe you're going through something. That is so far from the freaking truth. Just because we in science can't find something doesn't mean that you're dysregulated or dysfunctional or it's in your head. I am a big proponent of psychosomatic, brain, thoughts, and body-based things happening. There is a connection. There's no disconnection between the two. And I'm also a proponent that understands that what can happen is that our body can respond to our thoughts, and our thoughts can shift our body chemistry. There's a lot of bi-directional kind of connection between that system. And so it used to be thought that if we can't find it in your lab work, we got a cuckoo bird on our hands, right? That's not true by any means. Although if some doctors still are thinking that way, please find yourself a different provider, because that is just negligent and dismissive, and that's just their lack of knowledge to understand that all things are possible options. I say that we live in the quantum world in medicine or in science, is that anything is possible, right? Anything is possible. So we also don't have the right tools because we're so freaking intelligent, right? Like our bodies are so smart. Science hasn't caught up with the available imaging and diagnostic tools and blood cell tests that we're able to identify what's going on for you. So just because we can't find it right in this moment doesn't mean it's not real for people. One of the approaches that I take my patients through is we have to support their immune system. We go through all of the organ systems. We have to go to the liver because the liver is the largest immune organ. And we do know there's an immune system component to this condition as well as fibromyalgia. We have to look at the energy systems, things like your thyroid and your adrenals, as both of those are extremely metabolically active and alive. So we have to look there. We also have to look at your digestive system, your bowel movements, bloating, reflux, because those are other things that can tell us about how able or willing your body is to get rid of things. Now, your gut is your immunity. Your immunity is in your gut. 90% of your immune system lives in your gut. So that is why when we're dealing with such a chronic and complex condition, there is no cookie cutter pill. Now, traditionally speaking, sometimes what they do for people that are in a lot of pain, this is a very painful condition. Pain can come and go. Pain can be migratory in nature. We have pain that moves in our body. People can be confined to their bed. They could just be exhausted, where a small task like cooking lunch or cooking dinner is not possible for them. And so sometimes there are things that can help, like antidepressants, amitriptyline, sometimes anti-seizure medication, things in the GABA family. They use SSRIs. They can use things that are GABA modulators. GABA is the body's most inhibitory neurotransmitter. It can be calming and grounding, and it also helps to support the way that we produce other neurotransmitters. So there's a little bit of connection. Those are the traditional pharmaceuticals that may be used if you're dealing with this condition. It doesn't really fix the problem. And what I will say from experience and clinical practice is my people that are already on those things end up having to go up and up and up and up in dosage, and they still don't really get a lot of support. Maybe you do, and if you do, that's great. You know, I'm not here to knock anything that people do find support with, but they do use some of those kind of neurotransmitter modulator pharmaceuticals, because what happens is that we can increase certain hormones that can drop the pain signals in the spinal cord and the central nervous system. So when we have more serotonin, we drop the pain signals to the body. Now, by default, if we piece apart the word, which we talked about, chronic, long term, right? Not just like a day, not just a week, chronic, 3 months, 6 months, a year, 3 years. Myalgic, my means muscle, algic, that kind of term, that suffix or prefix is pain. In medicine, anything algia is pain. Encephalo means brain, itis, inflammation. Okay. Now back in like the 1900s, I want to say like 1907, we actually have come a far way in terms of how we've transitioned understanding things like CME and even fibromyalgia. Fibromyalgia is another one. Fibro, connected to the fibrous tissue, muscle, pain in the muscles, algia, pain. There's a lot of overlap between these two conditions, and we really have come a long way to learn about them, but we're still not anywhere where we need to be to understand the intricacies and specifics of the tissue.